I want to talk now to Dr. Stephen Thomas. If you've been watching, you know, he's an infectious disease specialist, our expert who we've been relying on for very accurate information. He's from Upstate University Hospital to talk about, we're in a different place now, Dr. Thomas. Now, the coronavirus, we have 2 confirmed cases. So what exactly does that mean for everybody? How do we need to change the way we've been living our lives?
Right. Yeah, so we are in a different place, but it's not a place that we didn't expect. So we knew that ultimately we were going to have COVID cases in central New York and in Onondaga County, and now they're here. And now all the preparations that the medical infrastructure has been undertaking and the county's been undertaking, it's now time to implement those plans. So what it means at the individual level is it means, first of all, continue to do the things I've talked about before, which is making sure that you wash your hands frequently with soap and water and or an alcohol-based gel, respiratory hygiene, making sure you try not to touch your face or your eyes or your nose. But now the new thing, which is going to be different for lots of people, is the social distancing that is going to be requested of people.
Yeah, and now we break that down. You know, we talk about, all right, so I'm not going to go to the movie theater. Can't, now it's closed. I'm not going to the gym. But then there's the more mundane. Do I go to the hair salon? Do I go to the nail salon? You know, is it okay to go to the mall? That kind of thing. So what advice do you have for people for those everyday things that you're still probably thinking about?
Right. So if we really want to, this term we've been using, flatten the curve, which basically means if we want to take on this pandemic and we want to make sure that we don't override the medical infrastructure capability to take care of our patients, there really needs to be a strict interpretation of this. And so that means, in my opinion, any large groups. So your family unit is one group. You're always together. That's one thing. But any kind of, I can tell you just from ourselves this weekend, my family, we did not go to a birthday party.
So put everything on hold.
Absolutely, absolutely. And there's some people, especially older people, people that have pre-existing medical conditions, diabetes, heart disease, lung disease, etc. They need to think very, very carefully about getting into situations where they're with groups of unknown people. So I would not get on a plane right now. If I was in that group, I would not be going to bingo. I would not be going to church. I would not be going anywhere where there's a lot of people that, some of whom could be infected and then transmit that to you.
All right, and what about our kids? What advice do you have for them? I know a lot of parents who, have to stay at home.
Right.
That's right. But what if you don't have that option, that you need to put your kids with other families? What advice would you have for them? Right.
Yeah, so one of the things, we do know that children can be infected with SARS-CoV-2, which is the virus that causes COVID-19. Fortunately, kids seem to do okay with it. Some of the reports that have come out of Asia, the kids do fine, right? But the issue is the kids can get infected, the kids can then transmit that to other people. So you could have a child that goes to a large group with other children, they get infected, they're going to be fine, but then they come home and they could potentially transmit it to a parent who has underlying medical conditions, or a grandparent, or even somebody at home who has an immunosuppressed condition, maybe from a cancer or some medications that they take. So I would be very careful about the size of the groups that I put my children in, and I would be very careful that the parents who are deciding to put their kids together make sure that none of the kids are sick. We do this normally, but really we should be extra vigilant at this point. Absolutely.
Yeah.
Absolutely.
All right, and let's talk about the virus itself. It lives on surfaces, we know that. And when we're cleaning our household, and I heard that you should let the disinfectant sit there for like maybe 4 or 5 minutes before you wipe it down.
Yeah, so they do know that this type of virus can persist for hours to even days sometimes. So we do know that. But we also know that cleaning with alcohol-based cleaners or chloride-based cleaners, bleach essentially, is very, very effective at killing the virus, making the virus inactive, getting that virus off the surface. So yeah, so in terms of leaving a disinfectant on for a certain period of time, you can read the instructions on the back of the product that you're using, and you can follow those.
Good advice. And the coronavirus itself, if someone gets the coronavirus, can they get it again? Are you immune from it once you get it?
Right. You know, that's a great question, and the scientific community right now is trying to figure out that answer, because that could mean, it could make a big difference whether or not somebody's, you know, you get infected and you're immune for a number of years or even life, versus every year you're at risk. And so that's something that they're trying to figure out. We know with some of the community-acquired coronaviruses, so the ones that cause about 30% of the normal common colds that we have in the fall and winter, people can get reinfected with those. But with SARS and MERS, it seems to be, which are more closely related to SARS-CoV-2, that does not seem to be the case. So people are trying to figure that out right now. That's to be determined, but we're hoping that that's the case, that people have immunity.
We hear so much about people who have it. We don't hear a lot about the people who recover from it. And there are many people who are recovering from this coronavirus as well, right?
Correct.
Yeah.
Absolutely. So it looks like if you take the total number of confirmed cases on the planet right now, which is just over 180,000, and you take the number of fatalities, the case fatality rate is about 3.8%. If you look at the number of cases in New York State and the number of deaths, the case fatality rate is about 0.8%. Now, just for context, that's still about 8 times higher than what the influenza fatality rate is. And as I mentioned this morning on Bridge Street, that influenza kills about 40,000 people a year in the United States. So this is still a pretty bad virus. But yeah, so that's kind of the context there.
All right, Dr. Thomas. Again, best advice: just stay home if you can.
Absolutely. Social distancing.
Put everything on hold for a while.
Social distancing.
All right.
Absolutely.
Thank you, Dr.
Thanks.
Thomas. And we do have the latest information from the county, the state, federal health departments, the governments on the News Channel 9 app. Our team is constantly posting information. We're working hard to keep you up to date. Now here's John.